Hello, everyone. Hello, everyone. Welcome and thank you for joining us today for our national webinar series. As you are logging in, please use the chat to let us know your name, agency, and where you're located. My name is Karis Manus. I'm a Senior Associate for Learning and Dissemination here with the National Community Action Partnership. And I will be working behind the scenes today, along with my colleague Denise Waits, to help the webinar go smoothly. A few technical notes before we get started. We will be recording this webinar, and we will share both the recording and the slides in a follow-up email within 1 to 2 days following the presentation. If you have any questions or comments during the presentation, please submit those through the chat function. Again, welcome everyone, and thank you for being here today for our webinar on innovative partnerships to advance health equity. Today's webinar is brought to you as part of NCAP's partnership with the Association of State and Territorial Health Officials and Gramercy Research Group. Joining us today, we have 3 community action agencies who will share with us about their experiences and lessons learned through the Vaccine Equity Project. As we get started, we want to begin by acknowledging that every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes in hope of a better life, and some have lived on this land for more generations than can be counted. Today, I'm joining you all from my home in North Carolina, and for me, this meeting is being held on the traditional lands of the Lumbee people. I pay my respect to elders, both past and present, who have stewarded this land throughout the generations, and we invite you to use the chat to acknowledge the lands where you're joining us from today, and we'll share a link for you to learn more. We also want to begin by grounding ourselves in the promise of community action that brings us all together. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. For today's agenda, we will have our welcome and introductions, followed by an overview of the vaccine project and presentations from each of the 3 community action agencies. As time allows, we'll also have a time for a question and answer, and we'll close by letting you know about our resources and upcoming events. As I mentioned earlier, my name is Karis Manus. I'm a Senior Associate for Learning and Dissemination here with the National Community Action Partnership. If you are not already familiar with the NCAP team, I wanted to introduce you to many of the names and faces that have been behind the Vaccine Equity Project. This project has been led by Lily Seals, the Director of Practice Transformation, and has been a joint effort between both our practice transformation and our organizational capacity building teams. The NCAP team has partnered with ASTHO and Gramercy Research Group to provide training and technical assistance for this project by hosting monthly learning community groups, participating in site visits at each of the participating agencies, and providing support with identifying strategies, action planning, and implementation. Also from the NCAP team today, we have joining us Lily Seals, Taylor Daniel, who's also a Senior Associate for Learning and Dissemination, and Denise Waits, our Administrative Coordinator. The ASTHO team for this project has been led by Geetika Nadkarni, the Director of Infectious Disease Infrastructure and Policy, along with Kate Heyer, the Senior Director, and Shalini Nair, the Senior Analyst. ASTHO is the national nonprofit organization representing the public health agencies of the United States, the U.S. territories, and freely associated states in Washington, D.C., as well as the more than 100,000 public health professionals these agencies employ. Gramercy Research Group, led by President and CEO Melissa Witt-Glover and Project Manager Tiffany Williams, have served as the evaluation experts for the project by creating a comprehensive monitoring and evaluation plan, developing evaluation tools, and evaluating activities to identify barriers and promising practices. This project has also included an advisory committee of several partner organizations, including the National Association of State Offices of Minority Health, National Association of Emergency Medical Technicians, the National Association of Community Health Workers, the Association of American Indian Physicians, the National Medical Association, the New York Academy of Medicine Center for Aging Healthy, the National Hispanic Medical Association, Faith for Vaccines, and Pacific Island Health Officers Association. Before we get started today, I wanted to provide a quick overview of the project and provide some background and context for you all. So in 2020, the CDC launched the Partnering for Vaccine Equity program to provide funding support to over 500 national, state, local, and community level organizations to reduce disparities in vaccination rates among racial and ethnic communities. ASTHO received funding under this program to work with local communities across the U.S. to increase vaccine access and uptake among adult minority populations. Working in collaboration with NCAP and ASTHO, 5 community action agencies were funded under this agreement and meet routinely to share strategies and lessons learned. The 5 agencies selected for this project include Community Action Partnership of Kern County in Kern County, California, Pickens Community Action Committee in Pickens County, Alabama, Palmetto Community Action Partnership in Berkeley County, South Carolina, the Community Action Program for Central Arkansas in White County, Arkansas, and Enrichment Services Program in both Troup and Stewart Counties, Georgia, and neighboring Russell County, Alabama. Community action agencies proved to be the right partner for this project because of their existing role as trusted messengers in the community, their strong established partnerships, and the wide array of services they provide that address the many social determinants of health, including childcare, food and nutrition, employment, and housing. The project kicked off in January 2022, with each team designating a core community action team comprised of agency staff, customers, community partners, and healthcare stakeholders to help design, plan, and implement strategies to reduce disparities and increase vaccinations. These diverse partners included residents, faith-based and other nonprofit organizations, local schools and universities, and public health departments. They also engaged a range of local healthcare providers, such as federally qualified healthcare centers, physicians, community health workers, EMTs. The partners all provided unique and valuable community perspectives. The CAT teams worked to develop a comprehensive action plan outlining their desired outcomes, strategies, and key activities to guide their efforts. And through engagement in the monthly peer sharing and learning meetings with ASTHO, NCAP, and Gramercy, the teams applied their learning throughout the process to continually evaluate and improve their strategies. While this project initially focused on COVID-19 and flu vaccine disparities, this model of building partnerships and trust, not only around vaccinations, but around other health equity related issues, is one that can be replicated in other communities. These partnerships, particularly between community action agencies, public health, and other healthcare providers, are a promising practice and represent a significant step towards advancing health equity. With that, we have 3 of the teams from this project with us today to share about their experiences and lessons learned. To get us started, I'm going to hand it over to Jamie Chandler. Jamie is the Director of Community Services at Enrichment Services Program.
Good afternoon. Thank you, Karis. Wrong Jamie, I am Jamie Thomas, but I do know Jamie Chandler as well, so no big deal there. Good afternoon, everyone. I'm going to share my screen and go through a brief overview of our project and tell you about some of the work that we've done. And also we have one of our partners that will be participating on the panel with us today as well. So again, I'm with Enrichment Services Program. A little bit about our agency. Our mission is to empower families to thrive through quality education, services, and partnerships. Enrichment Services has an 11-county service area, 10 counties in Southwest Georgia, and 1 in Eastern Alabama. For this project, ASTHO selected Stewart and Troup counties in Georgia and Russell County in Alabama for us to focus on. We do serve over 1,000 children and families with our early childhood education programs. And an interesting fact about us is that we serve 3 counties in the top 10 Georgia counties with both aging and declining populations. And 2 of those counties are in the top 10 counties in Georgia with the highest poverty rates. So again, for this project, 3 counties were selected, and I'm going to give you a little bit of background information on each of those counties. So Stewart County in Georgia, our county with the smallest population for this project, it's very rural. As you can see on the screen, the population there is only 5,314, and the poverty rate there is over 50%. Some of the largest employers would be the school system and a privately operated immigration detention center. To the north, we serve Troup County. This is also in Georgia. That population there, 32,752 in that largest city of LaGrange. And then also the poverty rate in Troup County is just over 40%. There's some larger manufacturing companies that are located for employment with Kia Motors and Walmart Distribution Center. In Russell County, Alabama, that is just over the bridge, or there's a river that divides Columbus and Alabama and Phoenix City, Alabama. So in that county, the poverty rate there also just over 40%, and the population 61,058. So our strategy with this project was really to develop simple yet effective messaging. We wanted to make sure that the messaging was clear and easy to understand, and that our trusted messengers were able to pick up on something that was very quick and effective. So we came up with 3 messaging points: vaccines are safe and effective, vaccine saves lives, and vaccines save your money. So with that messaging, we then wanted to partner with trusted messengers. So for us, some of our key partners for this project have been the Department of Public Health, churches, and the faith-based community, and civic groups. So really looking at a lot of the counties that we serve, there are not many resources available out there. So we really went to the churches to develop those relationships and kind of get in front of an audience where there were people there that were trusted and could help us to share that message. So with that strategy, we wanted to utilize our trusted messengers and then have them disseminate the information. So for us, it was very important to have some branding. So we did come up with a specific logo just for this project, and we used that logo on all of our printed material. For us, it was important to use this printed material versus electronic media, because a lot of the people that we are looking to serve were not connected via social media. There's issues with broadband connectivity. So we wanted to have some tangible objects, not just flyers, but we got some branded material that would also serve as conversation starters. So when somebody was out in the community, whether that was one of our trusted messengers or the people that we serve that have either received a vaccine or got some of our information, they had those branded items so that when they were out, if somebody asked them, hey, you know, what is that all about? They could share some of those key messaging points. So some of the material that we did, just basic things like pens, we hand sanitizer, we did fans because we did go to visit the churches, and our strategy there was to visit a church about a week before there was an event so that we could get this information out to the community in anticipation of that event and tell them, you know, we would be on site, we would have a vaccine provider, we'd also provide gift cards as incentives for people to get vaccinated. So it was very important for us to get to these churches and hand out that information prior to the events. So now I'm going to talk a little bit about our featured partner on this call. So one of our key partners is Valley Healthcare, and they are the federally qualified health center in our service area. Our partner that's going to speak in just a moment, Dr. Asante Hiltz, she also served on our steering team in another capacity before she transitioned into her current role. She was at the Department of Public Health. So now being the CEO at Valley Healthcare, it has really helped us to continue to further this project, because one of the challenges we had was finding a vaccination provider that was able to operate in all 3 of the counties we served. When we partnered with the Department of Public Health, because we crossed state lines, it was challenging there to get some of those vaccines into another state. But now having Dr. Hiltz on board in this different role, we are able to reach out to them to help us provide vaccines in all of those counties. So at this time, I am going to turn it over to Dr. Hiltz, and she can talk a little bit more about our partnership.
Good afternoon, everyone, and thank you, Jamie. I wanted to just highlight some of the ways and the opportunities that we had to partner with enrichment services during this program, and it has been great. And as Jamie mentioned, I was with the Department of Public Health, Georgia Department of Public Health first, as a steering committee member, along with our immunization coordinator and one of our outreach staff, looking at how we can make the COVID-19 vaccine more accessible to the community members. And largely that was done using our mobile units, going out into the community to meet people where they were, whether that be at a game, a recreation center, a church, any community event that was happening, like a health fair. And so the unique thing is that when I came here to Valley Healthcare System, we were able to continue that relationship. I remained a steering committee member. And now here at Valley Healthcare System, we also have a medical mobile unit that functions in a very similar capacity. So we go out and we offer some of our comprehensive medical services off of the medical mobile unit, which includes the COVID-19 vaccine. And that is one of the ways that it makes it attractive to the community. There's a few ways, actually. The first one is that enrichment services and the Vaccine Equity Steering Committee does have incentives that we can provide to community members to encourage them to get the vaccine, to at least start the conversation. So that attracts people to come over to say, I may not have been interested, or I'm on the fence. We talk to them about the incentive that they could potentially receive, and it helps them to get their shot and come back for their subsequent shots and their booster shots. On the medical mobile unit, we also offer the additional services. So we say, hey, we're coming into a community or a pocket of the community that may not have a medical home. So we're starting off with the COVID-19 vaccine, but we're hoping that that would open the door so that we can get other vaccines, vaccinate your children, your other family members, get a provider for other services. So that's why the partnership has been so effective, because the COVID-19 is going to open up the door. The incentives help try to encourage people to get the shot. And then we can also offer additional services. So it's beneficial on both sides. And that's what we've been doing, working with the committee, whether from the public health side at the health department or Valley Healthcare System, which is still essentially public health. And the outreaches has been the biggest component.
All right, thank you, Asante. So there is on the screen now, you see some pictures of that medical mobile unit. And then we have just some contact information there. If you want to learn more about our particular vaccine equity initiative, the link there is on your screen, and my email address and Dr. Hiltz's email address is on the screen as well. Thank you.
Thank you.
Thank you so much, Jamie and Dr. Hiltz, for sharing. Next, we're going to hear from Pritika Ram. Pritika is the Chief Business Development Officer with the Community Action Partnership of Kern.
Hey, are you able to see me? Hi, can you hear me?
Pritika, we could hear you, but we can't see you. We could see the slides.
Okay, we'll go ahead and get started. I'm seeing a message that says you cannot start your video because the host has stopped it.
Let's try it now, Pritika.
Okay. There we go.
Mhm.
Great. Thanks, everybody. My name is Pritika Ram. I'm the Chief Business Development Officer for Community Action Partnership of Kern, located in California. And I'm joined today with Reina Alges. She's the Executive Director of Building Healthy Communities and is one of our main subcontractors for this project. So her and I are going to co-lead the presentation. Okay, next slide, please. So as you can see on your screen, we have a partnership with Kern, South Kern Seoul, which is Reina's team. And then we also had partnered with the Bakersfield American Indian Health Project. And so at the time when we got our second extension on the contract, prior to that, we were able to work with the Native American population through the Bakersfield American Indian Health Project. And they were able to allow us to extend the vaccine project to their very tight and closed community. So we were happy to partner with Johnny and his team. And so that essentially was the three partnerships when we initially started. Next slide. And so our focus really was in Kern, and that is so much different than some of our partners, including our previous presenter that had so many counties to work within. Unfortunately, we just had one county within Kern, but in a later slide, I'll talk a little bit about some of the challenges even with that. But a little bit about our service area in Kern, which is basically in the Central Valley area of California. Our total population is nearly 1 million, with majority of that being in the metro area of Bakersfield. Our medium income and poverty levels are similar to what other folks have shared, roughly around 60,000 and 18.5% of people in poverty. However, once you actually get into some of the smaller communities within Kern, those numbers can be double or triple. It just really depends on which subgroup that you're looking at. Same thing with unemployment. Holistically, for the month of May, it was 8.6 for Kern, but again, looking in communities like Weed Patch and Lamont, it can be double and triple that that rate. And so this was just a little bit about our makeup of our service area. And then I'll talk a little bit more about our target, which will be on the next slide, please. So we knew in terms of some of the vaccine hesitancy, we looked at data prior to starting the project of saying, where are we going to have most impact? Meaning, where are we going to put our efforts into? Because we knew in some communities in Kern, some folks weren't going to be open and receptive to hearing from partners like us about vaccine health and some of the strategies around that. Instead, we wanted to put our focus on communities that had a low adoption rate, but then also were willing to meet with us and have some of our partners and ourselves engage with them pretty frequently and hopefully change their minds. And that's something that you'll see in later slides that we've been able to do. But our target population was really focused on some of the more subpopulations within Kern County, which focused on the Black and African American community, the Latino community, as well as a more targeted approach with Medi-Cal recipients. And that was in partnership with some of the health plans as well. I mean, they had that data to share in terms of some of their clienteles that did not have vaccines or maybe expressed hesitancy towards that. And so we thought that would be a better approach of working with those communities that were more receptive and willing to work with us. Next slide, please. So a little bit about California. This was a snapshot that I took towards the end of June, where our total state or county essentially had a 43% rate of COVID shots. And so that was really great because I think when we initially started, it was around 20 to 30%. And certainly wasn't just because of us. There's a lot of great agencies in Kern County that have been champions in this effort and in this initiative that have been really driving force behind the high increase over the last couple of years, including the County of Kern, the City of Bakersfield, and public health have been just tremendous in moving the needle with vaccine education and actual shots. Next slide, please. Which is probably typical of a lot of your counties as well, but our county public health department has kept us up to date daily with this gorgeous dashboard that doesn't look very dynamic, but once you actually get onto their website, you're able to drill down on some of the data, which is powered by way of Microsoft, and really see some of the impact. So this was a snapshot that we took at the end of June, and at that time there was quite a few individuals that are still going through the vaccine series, and the death rate at this point is at 2,600, which has been pretty stable for the last several months. And so I think with some of the education that's been ongoing, even past the peak moments of COVID, have been really successful. Next slide, please. And so this slide takes, and this is again another interactive map. So if you do get a chance to take a look at it, please do. This is what we used when we were planning for our strategies on where we should put some of our focus. And so this dynamic map here allowed us to click on some of the zip codes that had a high rate of non-adoption, essentially, or people that didn't have a vaccine, and then also that had a large saturation of people, because we felt like that was most effective, although we did do outreach in areas that had less of a saturation of individuals, but we found it to be more successful when we were in communities that were a little bit more targeted and again willing to work alongside us. And so this map came in really handy, and again something that was created by way of county public health. Next slide, please. And so, you know, as we were making the plans on how we should approach COVID-19 in our community, and then during the planning process and implementation, we were still facing some of these kind of 3 points. One being the misinformation and distrust of the information that was going out, as well as who was providing that information. The COVID vaccine kind of took a turn essentially when it first started. And so really bringing it back to a public health issue and not so much political. And then also the service area. And again, with some of our partners and colleagues on the line, you had a much bigger service area, but for us, the roughly 8,100 square miles did impact us in terms of having to mobilize different teams and being responsive. But Raina, my colleague, will be talking a little bit more about some of the strategies that were used. But these were kind of the top 3 considerations and challenges that we took into account when, again, planning as well as in the middle of implementation. And the next slide, please. Here we'll go into our approach, which I'm going to transition over to Raina. But one thing I wanted to share too was some of the collateral that we built to be reflective of some of the communities that we were targeting, which includes mostly Hispanic. So we made sure the collateral was also in a different bilingual language, but then also just trying to make it a little bit more fun and accessible with QR codes, and although it seems a little content heavy, I think it was pretty descriptive of where to go. And again, we leveraged also our state campaign and initiative on incorporating some of the messaging. So we made sure we were aligned with the state messaging as well. So at this point, I'll turn it over to Raina.
Thank you, Pradika. And then we could go ahead and click on the next slide. And so we had our target was a lot of populations, right? We have Black, Indigenous, Latino, and other people of color and vulnerable community members living in Kern County. One very unique thing about Kern County is that it's home to a population of Indigenous community that oftentimes don't speak Spanish. And in the photo here, we're seeing a woman from the state of Oaxaca. She's from San Juan Mixtepec, and she's taken here by her son to the clinic. This community had just a lot of hesitancy to move forward with the vaccine. There's a lot of distrust of the government, and also they don't speak Spanish. Some of them speak a language, an indigenous language. And so it was really about trusting, tapping on the trusted messengers to ensure that we get to the communities in a way that doesn't seem super forced, but in a way that they get to ask questions. And so at this time, we did have a clinic with them, and they were able to ask questions directly, and we had interpreters providing interpretation. But one of the big things is that we do believe that we could do more together. And we did it by partnering with community organizations, in addition to ours, in addition to Community Action Partnership of Kern, to get to the people that we needed to get to. And that meant partnering with local leaders, faith-based organizations, local government, and grassroots groups. we held vaccine clinics in communities with low vaccination rates. So instead of just thinking, okay, well, this community needs us, we relied really heavily on data. And that's where we showed up in the communities that had really low vaccination rates. We partnered with community leaders. One of the really nice things about this project was that we were able to partner with mayors, with city council members, and we would share data with them because oftentimes they didn't know where to get the data. How was their city doing compared to other cities? We gave them data, and in turn, the city of Wasco allocated $52,000 to provide vaccine incentives for folks who get the vaccine. And so they were just very impressed by the numbers, and not impressed by the numbers, and they wanted to increase their vaccination rate. And so so we told them that incentives work, and that's how we were able to get them to allocate $52,000 from their budget to do this. We also partnered with media and heavily used social media to target communities. And so if we were going to be in one particular city, we would target their zip code and boost a post in that community to let them know that we were going to be there, because we know it takes around 7 times for a person to make a decision or to feel invited to something. And so they would see it. We would door knock in their community, we would go door to door. We would set up a little a table outside of their local grocery store, had conversations with the community to let them know that we were going to be in their community with the vaccine clinic, the following weekend. And then they would come home, open their phone, and they would see it on Facebook, another invitation. And so it felt like they were being invited, and that this was truly for them, and that it was important for them to get their vaccine. Media was our partner. As soon as we were going to have a vaccine clinic, we would let them know all of the dates for the month, and they would put them in their community calendar, or sometimes invite us over to talk about the clinic, but also invite us after, or we would share photos with them, and they would post pictures of the clinic, even if they weren't interviewing us. And so all of this just created more credibility combined. And then we combined clinics with food distributions and giveaways. And so one of the very nice things with partnering with Community Action Partnership of Kern is that they also are the folks that take care of our food bank here in Kern County. And so we were able to bring food to the clinics. And so now it was a double whammy. It was a food distribution plus a vaccine clinic. And then we just attended community events to inform the target populations of our upcoming clinics, like I shared before. Next slide, please. And so this is a picture of when we invited the community to a food distribution. And so when 300 people showed up in cars to pick up a food box, we also let them know that we were going to be holding a vaccine clinic starting in 2 hours at the same location, and that we were giving $50 incentive cards for gift card as incentives for folks who got the vaccine there. And so they would come pick up their food. They knew there was going to be a vaccine clinic. They felt invited. They would come back, and they would bring their family members. And so that really helped. We also did phone banking. This means that we would, anybody who got a vaccine in our clinic, we would collect their phone number and their name so that we could remind them if they needed a boost or a vaccine booster or anything else in the future, or when we were going to come back to their community, and if they knew other family members that needed the vaccine, to let them know. We partner mobile vaccination units with incentives, easy to navigate websites, and we really relied on the state website to inform community and to also find the numbers. So like if we were going to be in Wasco, we would go on media and let them know, hey, your vaccination rate is it was once at 40% compared to the county rate at 50%. And so it's important that we get the community vaccinated. And so that was very, very helpful to us. Next slide, please. So I shared before, we leverage programs under the CAP-K umbrella. We brought food and conducted food distributions. And then we also came back with the vaccine clinic. So it kind of helped us break the ice with communities that didn't really want to partner to host a vaccine clinic. We utilized the bookmobile and food distribution sites and other pop-up events to inform community about the vaccine clinics, but also about the importance of getting your vaccine clinic. So if there was a little bit of hesitancy, we would share information. Like if the person was pregnant, we would share information for so that they could get educated on why they needed the vaccine. We would let them make the decision themselves, and then they would come back. We had a person who was pregnant. We shared information with them at one point, and then they came back to the following week to the same place to get her vaccine. And she said, I read it, I did my research, and it's important for me and my baby to get the vaccine. And they did. So that was very nice to see. Next slide, please. And then I'm going to pass it back to Pritika.
Great. Thanks so much, Raina. And so we wanted to just highlight, this is one of the last slides here, but just highlight one of the community events that we had that speaks to what Raina was explaining around partnerships, but also just leveraging what's already in the community, because we totally understand that a lot of the work that we're doing is part of kind of a larger picture. And we're asking our community members a lot of engagement, asking a lot from them in terms of engagement and showing up. And so we wanted to kind of couple the vaccine clinics with incentives and leverage resources. So through this back to school event that we had last summer, we had a really gnarly turnout in the best way possible. But at the same time, we were able to then provide back to school giveaways and incentives like that. And that's probably one of the more successful strategies that we used because of the flexible funding by way of this grant in particular. We were able to offer incentives for engagement. And so I think that helped bring a lot of people out. And then again, just working with some of our partners and then some of the programs underneath the umbrella of CAP-K and leveraging those resources as well. And the last slide, which is the next slide, is just a recap of our numbers. And so as of May of 2023, we were able to report nearly 1,400 vaccines that were given system-wide, at least through this grant project. And that's not even all the work that Raina and her teams do. This is just for this reporting grant, and able to touch quite a few people, nearly slightly over 2,700. And so with that, this kind of concludes our presentation. And the next slide is just our contact information if you ever want to reach out and talk to any of us. Thank you.
Thank you, Pritika, and thank you, Raina, for sharing. Next, we're going to hear from Pickens County Community Action. We have joining us Cynthia Simpson and Damika Lark, and I know they're having some heavy rains in their area, so I hope they're still with us. Can you hear us, Damika?
Harris, can you hear
Yes.
us?
Yes, we can hear you.
Okay. Okay, the host with the video, I need the approval to.
There you go.
Okay. And everybody, we're having some internet problems and everything going on here, but we're going to try to do the very best that we can in doing our presentation. Again, I'm Cynthia Simpson, and I'm the Executive Director for Pickens County Community Action. Pickens County is located in West Central Alabama. We're one of the 8 counties that is considered in Alabama's Black Belt. It is titled Black Belt, given that name because of the rich black soil that located in those counties. We're very rural. We have a population of 20,000 people in our county. Our agency provides services to one county, and that's Pickens County. When we started the project, the first thing that we did was develop a CAT team for the project. And on that CAT team, we had doctors, we had health providers, we had various community partners that are located within our community. And we found it very necessary at the very beginning to have partners in that we could work with in this project. One of the things that we also did was identify the areas in our community that we would be servicing. We wanted to identify those underserved communities. We wanted to make sure that we were contacting and providing services to underserved populations, all of the minority populations. We wanted to make sure that there was equity in our vaccine distribution throughout our community. One of our partners that we partnered with was the HRSA project, which the agency was already administering or implementing with vaccines. So we had already developed a platform on how we were going to reach those communities with the HRSA program. So it was sort of, it was easy to blend our programs and to partner with HRSA because they were already established in administering vaccines throughout the community. But now we wanted to discuss with them and develop a way to ensure that even though vaccines were being administered in the community, we wanted to make sure that there was equity and equality in administering those vaccinations to ensure that the entire community, the entire population were receiving the vaccinations. So at this time, I'm going to, I have D'Amica, Ms. Edwards here that does data. She collects data for the agency, and we collected data for this project to ensure that we were on target as far as administering our vaccinations. And Mr. Davis is going to come on after her. He is the director for the project director for the HRSA project that the agency administers. So Ms. Edwards.
Good afternoon, everyone. I briefly, as Ms. Simpson stated, the foundation had already been laid with the HRSA, with the COVID vaccinations. We were able to partner to not only help the community with COVID vaccinations, but we saw an increase in those that wanted the boosters for the COVID-19 vaccinations. At the beginning, we all know that there was a step, booster 1, booster 2, booster 3, and even as the year went on, we saw that the booster evolved into the one main booster. So we saw quite a few residents who wanted that. Also, we saw an increase in residents wanting the pneumonia vaccination as well as the flu, because we know we had a high flu rate in our area as well. But the majority outside of COVID, we administered, partnered with Hill Hospital in Sumter County. As we've shared before, we don't have a local hospital in our county. So I think that the vaccine equity project, as well as the Hersey project saved lives in our community. But the other vaccination that surprisingly was popular was the shingles vaccination. Outside of COVID and the boosters, that was our #1 request. So that was great. And as Ms. Simpson stated about partnerships, and the CAT team was established years ago. Ms. Simpson laid the foundation of the importance of partnerships, because we are in a rural area, 20 miles, 25 miles from Columbus, Mississippi, 30 miles from Tuscaloosa, Alabama, approximately. So we had a council already established of 30 plus agencies and organizations, not only in Pickens, but outside of Pickens. And we're excited because those partners allowed us to place surveys in their areas of business. We went out to the rural, we are rural area, but those really rural areas, set up at local churches, housing authorities, things of that nature. Right now, Ms. Simpson just made another partnership with the University of Alabama. Of course, that's a large college over in Tuscaloosa. We were fortunate that they allowed some of their nursing students to become ambassadors who were interning in their degree area to serve and to go out. That was great. And that partnership led into a new partnership that Ms. Simpson just joined with University of Alabama through the Hersey. And it is talking about post-COVID behavior concerns and those of the opioid crisis. So the partnership that was already laid through the equity built a bridge to join another project that can help Pickens County, as well as our partnership with, we have a federal prison, FCI Aliceville, in our community, and that is a women's prison. We were just set a date to be able to go into the prison and join. They're having a wellness fair. They provide vaccinations to the inmates, but thought it was a good idea that we could come talk about health, wellness, other education, and the importance of them to take that vaccination. So those are some of the great things that the Interagency Council, which that foundation was laid for us to build, to continue to move forward through, as Ms. Simpson stated, the equity and the inequality in our community.
And to just sort of jump back, piggyback on some of the things that Ms. Edwards has just mentioned, being rural, a lot of people attend different churches in the community. So that's when we decided to, in order to reach some of those underserved populations, those underserved communities, and find out what were some of the thoughts, how did people feel about vaccinations in different communities, we then organized a faith-based advisory committee that began to meet and discuss some of their concerns that they had in the various communities and how we could better serve those communities, because we wanted buy-in from all the communities, all of our partners, to work with us in implementing the program in those communities to make sure that there was equity and equality in vaccinations, COVID, flu, pneumonia, shingles, in those communities. So we began to meet with the faith-based community. And as a result of that, we had recently a huge faith-based forum where they met, and we had close to I want to say 100 people there at that forum. And we collected a lot of information. We shared a lot of information. And one of the things that that committee has grown into one of the agency's grassroots committees, that when we talk about sustainability after this program ends, we want to utilize that committee to continue to talk about education, vaccines, equity, not only in vaccinations, but equality and equity in other health determinants that we found that might be affecting our low-income community. So just to share with you how we organize that and how we plan to use that platform as a continuous improvement in identifying and providing services in various communities here, especially our low-income vulnerable populations and communities. So we've had health fairs that have been very successful. We've had other on-site vaccinations. We partner with, I have Mr. Davis that will tell you a little something about that, how we partner with them. And we go out and provide vaccinations at their pop-up clinics. We partner with the different, we have 2 clinics here because as Ms. D'Amica said, we don't have a hospital. So we utilize our health clinics. We have 2 that are in the area that we utilize. So Mr. Davis, just briefly.
Wow, Ms. Simpson and Ms. Edwards has covered a whole lot of ground, y'all. And one of the things that you may recall her mentioning is the faith-based advisory committee and the meeting that we had here in Carrollton, Alabama. Let me say, first of all, the partnership that we've established, the COVID-19 HRSA partnership with the Vaccine Equity Project has been a wonderful connection, you all. As Ms. Edwards was saying, many of the things that we did and have been doing within the COVID-19 HRSA project, they are also doing within the vaccine equity, more particularly aimed and pointed toward shingles, tetanus shots, so forth and so on. So that has been a wonderful merging and a blending. All of the events that we did within the vaccine project, such as different basketball games, just trying to create a crowd and a certain interest. And now we can carry that over into the vaccine equity. But one of the things that she mentioned that really excited me about the partnership was the connection not only to the University of Alabama, but to a historic university here in the state of Alabama. We had the opportunity to invite the president of Selma University. So that's a whole nother area of interest that that this partnership has birthed over the course of the time that it's been in action. He was able to come and share with us, and then through his word of mouth, others have been blessed as well in reference to getting vaccinations done. So the entire partnership between HRSA and the vaccine equity has been a benefit for our entire county, and we know that it's going to be a greater victory, if you will, going forward. So I just want to thank Ms. Simpson as well as Ms. Edward for inviting us to come in and us making that connection, because people in Pickens County have been tremendously blessed based on the numbers that you heard from Ms. Edwards earlier, and we're looking to establish greater things. Okay, Ms. Simpson?
I'd just like to add, I know that we're probably at our 10-minute time, but just last week, the state legislative officials and representatives held a town hall meeting, and we were able to be a part of that. And that town hall meeting was the importance of reopening our hospital. So on today, as a matter of fact, local citizens from all over the county were provided transportation to go to the state capitol today to talk about the importance of reopening our hospital. And many of those in leadership are part of the interagency council that Ms. Simpson has established. So there is progress that's being made, and prayerfully soon we'll be able to say, no longer say we don't have a local hospital. We can at least say we do have emergency care, and through that partnership, we can continue to make the lives of the residents of Pickens County better.
Thank you all so much for sharing. We appreciate that. Unfortunately, we're running short on time, so we may not be able to do the full Q&A, but we do encourage you all, if you have any questions for any of the 3 agencies here with us today, if you can put those in the chat, and we'll be sure to address as many of those as we can in the follow-up email that you all will receive. But as we close, we do want to hear from you about your experience with today's webinar. So your feedback is important to us. If you could take a few minutes and complete this brief survey to let us know your thoughts, that would be greatly appreciated. And then we'll also share with some resources and upcoming events with you all. During the course of this project, we have curated a lot of resources on vaccine and health equity. So we'll be sure to share these with you all in the follow-up email as well, so you can check those out and see what's available. We also encourage you to check out our Webinar Wednesday schedule to see what other topics are on the horizon and make plans to join us for any of our future webinar training opportunities. We also have the Community Action Academy, which is the online learning hub for the Community Action Network. We encourage you to sign up and access free e-courses on topics such as family-centered coaching, advancing racial equity, and collective impact. We have fresh finds available on our website where you can access the latest resources, webinars, and funding opportunities from other organizations engaging in anti-poverty work. And we keep that updated periodically, so we encourage you to check it out and see what's currently available. Annual convention is coming up August 23rd through 25th. We'll be in Atlanta, Georgia, so we hope you're making plans to join us. We also will have a vaccine equity session at annual convention. We'll have enrichment services joining us again, along with ASTHO and the National Alliance for Emergency Medical Technicians will be doing a session with us. So we hope you can make plans to join us and be a part of that. We also have some special pre-con opportunities coming up at annual convention. So if you're a certified community action professional, you're eligible to attend our NCAP colloquium to gain insights into critical future workplace trends and policy advocacy. We also have an Excellence in Action Symposium that will showcase the real-world practices, providing the 35 community action standards of excellence are within reach for every community action agency. Participants will leave this event with a deeper understanding of excellence principles, tools, and techniques for implementing them, and inspiration to move forward in your agency's excellence journey. And we'll share information with you in the chat for how to register for those events. We also have a data convening coming up September 12th through 13th in Denver, Colorado. And we know the space is limited for that event, so we encourage you to register and click the link to learn more about that. If you have any questions following today's presentation, this is our contact information, so feel free to reach out to any of our team here at NCAP, and we can help you the best that we can. And once again, we just want to thank you all for being with us today and taking times out of your schedule to join us. We also want to thank all of our presenters for being with us today and sharing their experiences and the lessons that they've learned. We hope that you can take something today and apply it to the work that you're doing in your own local communities. Thank you all for being here.